The books that I have done for my whole life, for 25 years, have really been about why you should exercise, why you should eat well, why you should manage your stress. But all of that stuff is useless if people will not put it to work. What I wanted to do in this book was to share how was that done. And it really starts with the attitude. It starts with a positive attitude that says, I'm going to make a commitment, I'm going to persevere, I'm going to do whatever I can do to make this thing work. We know a lot about healthy living. Americans are very nutritionally literate. We are very exercise literate. We know the difference between an apple and a piece of apple pie. We know the difference between going out dancing and watching Dancing with the Stars. So we get it, we understand it, but we simply are not doing it. When you look at the numbers, hardly anybody exercises in this country or eats well, and for those reasons we've got heart disease and obesity and type 2 diabetes and other kinds of diseases and debilitating conditions that are connected to lifestyle. I live in the Pacific Northwest, which is a beautiful part of the country. But in the winter, it's cold and it's rainy, and I exercise in the morning. So normally my alarm goes off about 5 o'clock, and by 5:30 I'm out taking a jog. And one morning the rain was horizontal. It was about 30 degrees. I was under a down comforter, and I thought, there's no way I'm moving out of here. I don't care what the argument is. I'm just not getting up out of bed. It's too comfortable. I don't want to make the effort. But the radio alarm, on the radio, someone was talking about a fellow by the name of Bob Ireland, who actually was the last finisher in a New York City marathon in the 1980s. It took him 4 days to get through the marathon. The reason was he didn't have any legs. They'd been blown off in Vietnam. But Bob did that marathon on his hands. And I sat on the side of the bed and I just thought to myself, I've got 2 good legs. I've got reasons who are asleep upstairs that I should be doing this. If Bob could do it, I could do it. And by 5:30, I was laced up and out the door. So what I've tried to do in this book is to assemble those kinds of stories that will motivate us, that will cause us to commit, that will give us perseverance on the days when we just know there's a hot dog calling our name or we just don't want to do the exercise. I got interested in these topics the hard way. I went through bypass surgery at the age of 32. My children were very young. They were ages 6 and 4. The doctors at that point said, the prognosis is not good. We don't think you're going to live to be 40. You have an aggressive coronary disease. You're at a very young age. If you plan on seeing these children graduate from high school, that's not going to happen. My wife yanked my chain, thank goodness, my wife Bernie, and said, let's get some things straight. You cannot change the cards that you were dealt. You're 32, you have aggressive coronary disease, you can't change that. But you can change the way that you play those cards. And what we're going to do is eat well, exercise well, stay away from smoke, manage stress, do all of the things that just seem so logical, and see if we can't even up the odds. And I'm pleased to tell you that's exactly how it has happened. This year I will celebrate my 32nd anniversary of bypass surgery. To see my kids graduate from high school and college, and if I've learned anything in now 32 years since the bypass surgery, it really boils down to this. If you will not take the time for your health, I can promise you, I can guarantee you, you're going to have to make the time for your illness. I believe this book could be the most important book that I've done because it transcends what exercise is all about, what diet's all about, and gives people positive reasons and way to look at the world that will allow them to commit to healthy living.